Hello, my name is Mason MacDonald, and I am a workplace consultant with the Workers' Compensation Board of Nova Scotia. And I would just like to take the time to thank you very much for joining us. And this webinar is all about return to work and how to build an effective return to work program. So as you know, when you signed up for the session today, you might have noticed that it was originally marketed towards employers who are in the small or medium category. I just wanted to point out that if you are a large employer and you're taking part today, that's totally okay, because we're talking all about best practices when it comes to return to work. So no matter if you work in a small, medium, or large organization, everything's absolutely transferable. So again, thank you very much for taking the time to join us. I'm really excited to be here. I'm very passionate about return to work. And in saying that, I want to make sure that this is very fun and engaging. As well, I want to point out that at the end of this session, you will have all my contact information listed. So you'll have my name, my phone number, and my email. So if you prefer to connect with me offline and talk a little bit more about the discussion, I'd be happy to chat with you a little bit about that as well. So whenever I do talk about return to work, I always like to talk about my background because I think it does a great job of pointing out a couple things. For me, return to work was a very big part of how I started my career. And I think it's always important when you talk about return to work that you always have to be reminded that we're talking about someone's life. So I'll talk a little bit about my journey of how I got started. So I'm from Pictou County, Nova Scotia, Stellarton born and raised. I attended Acadia University and graduated in 2013 with a degree in kinesiology. So when I was after schools, graduated, I had a lot of friends that were looking to go to grad school or start work, and I wasn't really sure what I wanted to do, but I did know one thing, and that's I wanted to start to nail down some student loan debt. So I was very lucky to have the opportunity for myself to join working as a kinesiologist in a WCB approved clinic in Port Hawkesbury. So this was great for me because I had the privilege, again, to learn and work with injured workers and find out about return to work. So for me, I didn't know anything about WCB or return to work prior to. I'm a big sports guy, so I was just excited to learn a little bit more about anatomy and maybe get to see some really cool sport-related injuries, but it was a very good educational opportunity for myself to find out, again, what it's like to work with someone who's going through a workplace injury. And that's very important. So I got the good experience working and collaborating with members of the Workers' Compensation Board, working with other healthcare providers in developing good return to work plans. And I also got an opportunity to work with employers, and that showed me the difference of how certain organizations might handle return to work. And as I mentioned at the start of this, it's really important to, when we're talking about things like policies and programs and best practices, and the financial aspect of return to work, we can't forget one thing, that this is someone's life. And again, whenever I talk about return to work, I always have that in the back of my mind, that we are doing these things to help out Nova Scotian lives. So I had a real good experience working as a kinesiologist. I worked in Port Hawkesbury for a number of years. I moved to Halifax and worked as a kinesiologist at a clinic there before I joined the board in 2016 as a workplace consultant. So now it's kind of cool, my role, I've kind of flipped in a way where I'm no longer working directly with injured workers. I am working with employers, and I'm working with employers in a lot of different capacities. Some of them, for example, would be I might work with an employer to take a look at their current safety management systems. So my role could be to come into an organization and just take a look at seeing, hey, you're doing hazard identification and control program. My role could be just to offer some best practices of what I've learned from other organizations and see if we can make improvements. I might be working with an organization that has a brand new health and safety committee. So my role would be an educator to come in and make sure that everyone understands the roles and responsibilities in the committee and how to empower yourself to improve safety outcomes in your organization. As well, of course, a lot of my job is also around return to work. And I help support employers in the return to work journey. So you might be an employer who doesn't have a program, you're building it from scratch, or you might be an employer who's had a return to work program for a number of years, and you're just looking for ways to improve it. So again, I love working as a consultant. It helps to kind of paint the full story for you about my journey in return to work. And I think that it's an amazing tool that employers can use to help support their workers. So talking a little bit about our session today, we're going to focus on a lot of things return to work related. We're going to focus on why is return to work even important and what's the impact of a workplace injury. We're going to talk about how leadership is involved in good, successful return to work programs and how you can help build that program yourself if you are a leader in your organization. We're going to talk a little bit about some challenges and opportunities that I have come across working as a consultant, and I hope that I can help provide some solutions in case that you are often seeing the similar type of challenges. I'm going to highlight a couple of good resources that we at the WCB of Nova Scotia have around my account in WCB Online for injured workers. One of my favorite things that we here have at the board is what's called Working to Well campaign. So I'm going to highlight a little bit more about what Working to Well is and how you can use it for your business to better support your injured workers. And of course, to stay relevant, I know we're all likely COVID fatigued at this point, but I wanted to include a little bit about how the pandemic has impacted return to work. As promised, I'm going to make sure that we do have some time available at the end of the session where I'll try to answer some questions. And again, if I don't know the answer, I will absolutely connect with you offline and to make sure that we get you the help. So again, thank you very much for taking the time to join today, and I'm really excited to get started. So why focus on return to work in general? Return to work to me is extremely interesting. It's something that's really well researched and scientifically studied. So there's, of all the literature out there, there's one thing that's absolutely true, and that is the longer you are off work, the less likely you are to return to work as the time goes on. So I like to highlight this statistic. If you are off work for 6 consecutive months, there's a 50% chance that you'll ever return to work again. And that's huge to know that if you are in an organization right now looking at some claims and you're looking at how long people are off, it's important to be aware of the fact that if you have some claims that are lasting weeks, months, years, as time goes on, it's been found that workers are less likely to return. And in Nova Scotia right now, return to work simply is taking too long. Over the last number of years, our return to work claim duration has been increasing. And that's concerning and important to be aware of. And there's a lot of reasons as to why that might be. It's not so black and white. Claims today coming in are a lot more complex. We're seeing a lot of claims come in that are psychologically related. So looking back to me as a kinesiologist and looking at the rehab, I like to think of muscle sprains and strains. And generally speaking, when a muscle sprain or strain injury occurs, we typically can expect, not all the time, but we can typically expect recovery to last between 4 and 8 weeks. When you're dealing with psychological injuries, things like PTSD or maybe even concussions, it's not so black and white anymore. It's gray. So it's hard at times to manage these claims and find good return to work outcomes. If you look at the demographics of the province, we are aging. So again, putting my shoes into the rehab world, when someone is dealing with a muscle sprain or strain type injury, it's often harder for them to recover if they're aging. As well, I don't think Atlantic Canada does a great job in statistics around things like drinking, smoking, obesity. Those are all a number of factors that also add into that duration statistic. So all of these reasons, again, play into the big issue of return to work is simply taking too long. So we're trying to find ways to work with employers in other organizations to just talk about this, because the more we're talking about it, the more we can strategize ways to improve it. Of course, the pandemic has also impacted that duration statistic. If you were to rewind 1 year ago, that would be the time in the pandemic when things were completely shut down. So medical appointments, surgeries, appointments with your physiotherapist, your occupational therapist, chiropractor, they were all canceled. So for those individuals out there who needed to get treated early, they weren't able to. So that did not help their recovery timeline, and it did not help the return to work duration statistics. So those are a couple of reasons why it's really important that we focus on return to work, because again, we can't forget one thing, and this is dealing with someone's life. And speaking of that, talking a little bit about the impact of workplace injury. And this is where I put myself back into the shoes of a kinesiologist. An employee's life is majorly disrupted when they're dealing with a workplace injury. So think of all the things that you love to do. For me, I love to golf, and that's what keeps me happy. If I'm not able to do the things I love due to an injury, I'm gonna feel really down about that. And when I would be working one-on-one with injured workers, you would start to see that because of their injury, things in their life are becoming disrupted. Whether you're looking at things they simply love to do, they might love to come and watch their children's hockey games. If you are the sole provider of a family financially, your life is going to be disrupted. And this plays into a lot of their mental health, things about feeling valued, purposeful, supported. All of those reasons can be added into why it's important to have return to work programs in the first place. Because if you are an employer that has an effective return to work program, you can help out in those situations where they're feeling unconnected, they're feeling isolated. Good return to work programs help those workers in that way. The impact of a workplace injury absolutely affects your cost to your monthly and annual premiums cost. So if you're an employer out there that are very savvy when it comes to understanding how the costs and premiums work, to keep it very simple, the more costs that the WCB is paying out in terms of temporary earnings replacement benefits or a number of physio or healthcare appointments, the more costs we put out, typically speaking, you can expect to see an increase in your premiums if you're having a lot of injuries. So if you are looking at a number of workplace injuries a year, chances are, again, generally speaking, you can probably assume your premiums are going to increase. So for employers that have good return to work programs, you're able to reduce a lot of those costs by, for example, taking someone back to do light duties or modified duties. And we'll talk a little bit more about what that is and how that works. I think this one's a pretty easy one, disruption in company productivity. If you're having a lot of workers out there off work, your company's day-to-day operations are going to suffer. And I see that oftentimes when I'm working with organizations that are understaffed, it's because they have a lot of injuries on the go. And again, their day-to-day life is majorly disrupted. You might have lost a really skilled, experienced worker. And if you remove one person off the floor, that's going to, again, impact the whole life cycle of that work's day. So you might rely on a lot of skilled and veteran workers in your organization, and it's going to disrupt them if you're having a lot of those key individuals taken out. So whenever I think of the workplace injury and the impact of it, I think of that iceberg example. We're at the, above sea level, the tip of the iceberg, it's one thing, but if you look below the sea level, there's a lot more going on. So that's important, and it's the same thing when you're thinking of the impact of a workplace injury, which I think ties into wonderfully about the role of leadership in your return to work program. And one thing I love, what our CEO, Stuart McLean, speaks about often is the importance of leadership in organizations. And you don't need to be the CEO of an organization to be a leader and to be able to promote safety. And it's the same thing with return to work. Good leaders are very much involved in the return to work process, and they understand that everyone has a role to play in the process. So good leaders are making sure they're educated on the return to work program. They're moving quickly at each step, meaning they're not waiting days, weeks, months to do things like submit a WCB injury report form through my account, or doing things like making sure that their injured workers are attending medical appointments. They are understanding of the process and they're involved very much in it. They're very supportive and they stay connected to their employee. This one's a big one. And for the organizations that I work with today that have their leaders making sure that they're staying connected with their worker, that's huge. And what that really can just simply look like is picking up the phone and giving that worker a call just to say, hi, I heard what happened. I'm sorry. Is there anything I can do? You wouldn't believe the difference that makes in someone's life, because this is the conversations that they're having when they're attending their medical appointments. They're often going to be speaking about, do I feel valued? Do I feel supported? Do I feel wanted back? Good leaders make sure that they stay connected with their workers. Good leaders are also making sure that they have a list of meaningful and productive transitional or modified duties. You might say to yourself, hey, Mason, I have no idea what a transitional or modified duty is. So to simply put this, because I'm a simple thinker, I like to keep things very easy. let's pretend that I worked at an organization and my job was to lift 50 pounds. If I were to get hurt at work, best practice would show that I am, of course, my injury report form is going to be submitted to the WCB, and I'm going to be looked at getting a physio appointment if it's a muscle sprain or strain injury to take a look at my function. If the physiotherapist has found that, look, yeah, Mason can't lift 50 pounds, but he can lift 25. My question to you would be, does that mean I have to be off work altogether? The answer should be no. The things that we want to highlight here are, yes, we know I can't lift the 50 pounds, but what I can do, I can lift 25 pounds. And that's the way our language works when we're dealing with workers. We're always talking about what workers' function can do. So good employers are creating things like transitional duties, where I am in the transition of trying to go through the return to work process. I'm still injured, I can't lift 50 pounds, but I can do tasks in the organization at 25. So I might be doing some modified work, some different job tasks, or I might be just doing this from a transition from being injured to getting better. So having me staying connected in the workplace, I'm able to still, again, all those awesome things about being supported, being brought back, not feeling isolated. You as a leader can make sure your organization has a good list of those types of job tasks. Of course, respect workers' right to file a claim and take responsibility for your workers' compensation costs. It's not best practice when a workplace injury occurs to just put your hands up and say, you know what, I'm good, just let me know when the worker's better. You have to make sure that you have a responsibility in this process, and there never should be a time during the claim where you are unfamiliar with what next steps should be. And of course, proactively collaborating with WCB caseworkers, health service providers, and of course, the worker. So the Return to Work program is great for a number of reasons. It's great for workers and it's great for businesses. It's a win-win scenario. It's great for workers because it's keeping them active in the recovery process. Typically speaking, with certain muscle sprains, injuries, it's not good to do nothing. So if you're able to, again, as I mentioned, have someone come back to work doing some type of transitional or different types of job tasks, that's good for the recovery of the muscles. It's healthy. It's good for it's minimizing the impact of the workplace injury if you have a return to work program, because you're doing all those awesome things, like I mentioned, where you're keeping them connected to the workplace. As I mentioned, we spend more time at work than we do with our own family. So if you take someone out of a social circle that they're very much involved with, again, they're starting to have those mental health issues come in around feeling isolated and not supported and not welcome back to work. It also makes sure they maintain their sense of confidence. No one likes to sit at home and do nothing. So effective return to work programs have the ability to keep workers active, make them feel confident, and they don't have to suffer financially. Because if you are off work on a time loss injury, you aren't earning 100% of your salary anymore. So that is a big deal for a lot of people that need to pay the bills, and you might be the sole provider of that. So there's a lot of good reasons why you should have a return to work program for your workers. And again, it's a win-win for the business as well, because you're keeping those skilled employees that might have been there for 10, 15, 20 plus years. You're keeping those skilled workers in the workforce. The morale and the culture of the workplace is probably going to be better. For the organizations that I work with, where I'm actually there, I always find that if there's a good return to work program in place and there's great leadership behind it, you can just kind of sense that the moral and the cultural aspect of the workplace is just better. So it's a great incentive to say as an organization, hey, we have this program in place to help you. We got your back. And if something were to happen, we want to make sure that there's a consistent plan in place for you going forward, and we can help you get better and back doing what you love to do. It's great to also enforce good communication strategies with your workplace, because as I mentioned in the earlier slide, you have to make sure you're very much involved in the workplace when it comes to return to work. And if you have good communication strategies, that will absolutely funnel through to your return to work program as well. So you might be asking yourself, if you are an employer right now and you don't know really where to start, I just created 5 little easy starting points where you can just say, okay, let's go through the list. So one thing I always recommend to businesses that are starting to build a return to work program is you should absolutely have a policy and program in place, something written down. That's going to be your Bible going forward. So it's to say, again, here's our organization stance on return to work and why we have it. And again, it's all good reasons to help the worker and the business in itself. So you should at least look to create something. And if you don't, and you don't know how to start with that, please feel free to reach out to me after the session, because I can provide some really easy general templates that kind of walk you through how to build a program. And they're all great because it's customizable. So it's something that you don't have to recreate the wheel with. I would love to share that resource with you. Assigning responsibilities to your staff. That's another big one. Good return to work programs often have one key individual that's kind of in charge of return to work. And that's important because when it comes down to collaboration between healthcare providers, employee, the WCB, we're going to be reaching out preferably to one person to make this plan. It's not best practice if you have 4 or 5 individuals that do return to work. It's really good idea to have one person really in charge of the program, because that's going to save time on everyone's ends. So make sure you look to see if you can assign return to work responsibilities for one individual in your workplace, and develop a direct access relationship with a WCB approved healthcare provider. If I could leave today and I want to say one thing, it could be this, because I'm a big fan of direct access relationships. You might be wondering, well, what that is. A direct access relationship is basically a partnership between an organization and a WCB approved healthcare provider, where it's basically an agreement to say, hey, if I have injured workers, can we send them to you? If it's a muscle sprain, of course, I'm speaking about muscle sprain and strain injuries. Can we send them to you to get treated? In good direct access relationships, you'll have the healthcare providers actually brought into your organization. You could give them a tour, explain to them a little bit about your world, what type of work you do, show them a list of job site analysis, have a bank of transitional and modified duties all ready for them, so that if an injury occurs, you can send them to that facility and they already know you. They're already comfortable with what type of work you do. Again, I can attest to this from my days working as a kinesiologist. It's a lot of time if a worker were to come in and you aren't familiar with what type of work they do. You have to be comfortable understanding what job demands they need to do at work in order to properly functionally assess them. So that's a lot of time calling, contacting, and trying to, again, get an understanding of their world. So if you create this relationship, they already know all of that and they're comfortable treating and getting that person hopefully back to work on some type of transitional or modified duty if they're able. You might be wondering, well, how can I tell who is WCB approved and who isn't? So if you were to go onto our website, wcb.ns.ca, you will look and you will see a healthcare provider section. If you were to click on that, you'll see that there's a search directory. And what you can do is you can type in the address of your organization, and it does an awesome job of auto-populating some WCB approved clinics close to you. So you might find 5 or 6 around your area. So those would be good starting points for you to look to contact and develop that relationship with. Educate all staff on the return to work program and benefits. I have a lot of great employers out there that do wonderful return to work wise, but the organization doesn't know about it. This is something that you should be celebrating and talking lots about. Make sure everyone is understanding that you're loud and proud to have a return to work program. Because I mentioned on the previous slides, there's a lot of good reasons why it's great for businesses and workers. So make sure if you do have one, look to find ways to educate your staff on the program and its benefits. And of course, like any type of program that's safety related or return to work related, make adjustments as needed. It's not like once you create it once, it has to stay like that forever. So whether you're using one direct access provider and you want to include a couple more, feel free to do so. If you're finding it too much work for one individual to be owning the return to work responsibilities, maybe you'll have 2. So just always feel like you can always make adjustments and changes as needed that best fits your organization. So we're going to talk a little bit about some challenges and opportunities that I often see when I work with organizations when it comes to return to work. And one of those challenges often is about building awareness and educating your workplace on the program. Look, we're all really busy. So it's often very challenging and very unlikely to say, okay, I have a new return to work program. I'm going to take everybody in the room at once and sit them down and just let them know. I know that's probably impossible, but you have to find good ways that you get messages out to your employees currently and use that the same way to educate about return to work. So one thing, again, that I love that our CEO, Stuart McLean, does is if he has a message that's important to us and he wants to make it very personable, rather than sending an email, sometimes he uploads a video and tells the message and he uploads it onto our internal website. So we're able to, as an organization, log on and check out the message. It's a great way, again, to be very personable in delivering a message. And it could be you doing that with your organization when it comes to return to work. If you rely on email, you might do an all staff email to talk about this program. You might use your health and safety committee, rely on them to be the reps to the organization to go and talk about this. If you do toolbox talks, that's another opportunity to discuss and educate on your return to work program. So those are a couple suggestions I would have, but it's really important to know that you have to make sure your whole organization is aware of the program in the first place. Creating transitional and modified duties can also be a challenge, and I totally appreciate that because certain organizations out there do very specific work. They don't do a lot of different things, they do one thing specifically. So I can understand that it could be hard to say, oh my goodness, how am I going to create at least 3 or 4 more new jobs if we only do one thing? I understand that, but some suggestions that I've used with employers that have worked are doing things like using your health and safety committee. Because the beauty of JOSH committees is that they are members from all across the organization. So they are experts at what they do. And you'd be surprised how often that they can be creative and brainstorm good ideas. So they'll know, you know what? Yeah, we could actually use another body to help us with this. Use your health and safety committee, empower them to try and brainstorm some new suggestions when it comes to transitional or modified duties. Another suggestion I would like to add to that would be look to see if you can work with an occupational therapist, because I've had the pleasure of working with a lot of great OTs in my career, and I think that they're actually underutilized in this province. So look to see if you can get in touch with an occupational therapist, and oftentimes they work in those WCB approved clinics. So if you were to contact an occupational therapist, explain to them that this is what you're looking to do. You're looking to create more job tasks. It might involve you inviting them in for a day or two for a tour. And they're an excellent resource to do things like that. They're experts in occupations. So that's a great suggestion that I think that you should utilize in contacting an OT to get you helped out with that. Assigning responsibility when it comes to return to work can be a challenge, because if this is brand new to your organization, it might be scary to adopt a whole new program or policy and assign it to one person. But what you really need to understand is that when it comes to coordinating and collaborating around return to work plans, having 1 or 2 key individuals is best practice, because it's going to help, again, save a lot of time in the planning process. And you need to make sure that whoever is in charge of return to work, they have to be great leaders. And if you are a supportive individual and a supportive employer, the chances of them coming back are way, way, way better. Starting early and staying connected can be a challenge, because for some, if this is brand new, you might think that the return to work process could be confusing. But it's really important to know that you have to be on top of things to make sure that you aren't waiting a while to submit an injury report form to us, preferably through my account online. And you have to make sure that you're not waiting a while to get your injured workers to their medical appointments. So if you're doing all of those things and staying on top of it, you're likely to have a more successful program. And touching a little bit more about my account and WCB Online, these are fantastic resources that you can use, that we offer to support employers, and you can use this in definitely a return to work sense. So if you currently are not yet signed up on my account, I really, really recommend you do so. You can check out our website, wcb.ns.ca, and you can get signed up online that way, or you can always call into our main line and chat with our internal service associates, and they would love to get you set up with developing your My Account online, because it is a great tool that you can use that we offer to support employers. It's your #1 way to submit claims to us fast. So you can do this all online, and that is way better for us to get that in that way, because if you were to send a fax to us, we will still get it, obviously, but it's going to take a little more time to manually upload the information. If you use my account and submit claims to us that way, it's auto-populated. So we get that information quicker, and that feeds into helping the recovery begin sooner, because that allows us to register a claim number, start looking at what this worker might need in terms of medical treatment. So we're beginning that great, those key timelines on making sure that we're on top of the injury. We don't want to wait a while to get someone treated medically. You can also use my account as an employer to safely and secure message us. So we no longer rely on email communication when it comes to talking about sensitive claim related information. We use secure messaging, and that is the safest and most secure way to communicate with our case management team about claim related information. As well, if you are an employer, again, that's very in tune with your costs and your experience rating statements, my account does an awesome job of highlighting all the costs, what your monthly and annual premium costs are, what your experience, it houses your experience rating statements, and it also does a great job of storing all of your documents online as well. So if you don't want to have to print everything out anymore, my account can house all that information for you. WCB Online is something I'm always recommending to the employers I work with. You should always recommend for any of your injured workers to look to get set up on WCB Online, because like my account, WCB Online does a great job of allowing workers to safely and securely message our case management team. It allows them to send any type of electronic reports that they might need to get into us. And it's their one-stop shop, again, for dealing anything related to us. So I don't think anyone really likes to play phone tag anymore. My account and WCB Online help eliminate that issue. One of my favorite things that we here have at the WCB that I'm always recommending my employers to use in their return to work programs is what's called Working to Well. So Working to Well is a fantastic resource that we've created. It's a website, and you can see that it's right there, the URL, wcb.ns.ca/workingtowell. I recommend you check it out, because what it does a great job at is breaking down the roles and responsibilities of everyone involved in the return to work process. So whether you are a healthcare provider, an employer, an injured worker, or the WCB, it will help educate you on who's who in the zoo, what's everyone's roles and responsibilities. So I think that it's, again, a good resource for an employer to offer to an injured worker who might not be very familiar with the process. This might be the first time that they've ever dealt with return to work. So you as an employer could say, hey, check out this website. This will help explain the process going forward. So it's another added tool that you can use to support your injured workers. And as well, one thing I love about it is it's showing real life Atlantic Canadian return to work stories. And it will show the impact of everything I talked about the importance of staying connected to the workplace and what people go through when dealing with a workplace injury. And it does, again, a wonderful job of highlighting some real life Atlantic Canadian return to work stories, and it shows their journey. So I really recommend you check it out. You will learn a lot about it. And as well, I have workplaces that when they create the return to work programs, they can just simply call it Working to Well program. And if you were to contact our organization, we can submit to you a bunch of awesome promotional materials that if you wanted to, again, create awareness in your organization about return to work, we'd be happy to get you set up with some Working to Well kits. So we're getting close to the end of the presentation today. As promised, I wanted to stay a little relevant on topic and talking about how the COVID-19 pandemic affected us from a return to work point of view. And there were some challenges that the pandemic brought, but also some opportunities. So some of the challenges that I've come across working with employers are things like transitional duties. So it's great that they've created a list of transitional duties, but due to number restrictions in their organization, sometimes they weren't able to have workers come back on modified duties because of those restrictions. So certain organizations weren't able to utilize their transitional duties as they normally would. Promoting safety remotely is harder. As you know, most people right now are working from home, or a lot of individuals are working from home. And for the workplaces that I'm working with, it's harder for them to promote safety. I think of all the health and safety committees that I've been a part of, and they're usually used to all being there together. when everyone's separated, it's just a different feel. So that's definitely a challenge I'm hearing a lot as well. And for certain industries, they were majorly impacted by their simple work demands from the pandemic. And I just want to take an opportunity right now to thank each and every member who worked in those hard industries that kept this province going. So anyone in trucking, delivery, postal service, healthcare providers, you are truly the heroes of this province. Because if I think about a year ago, I was terrified just to go to the grocery store. And all of these members got up and went to work every single day at the scariest times of this pandemic. They truly are the heroes of our province. So just a big thank you for that. And I can totally appreciate how hard the work demands would have been on you during the pandemic. As I spoke a little bit at the start of this presentation, the return to work duration statistic, obviously the pandemic did not help that. So again, if we look back and reflect on a year ago, things like surgeries, doctor's appointments, all medical appointments at one point were canceled. So for people that needed to get treated early, they weren't able to, and that absolutely did not help their recovery. So it was very expected that certain claims were lasting a lot longer than they should. But going with all of this, there were some great opportunities that the pandemic brought. And it's kind of funny when I talk with my employers now, they're finding that their organization actually has a heightened safety awareness. A lot of people out there are way more aware of their surroundings, who's around them. You know, they're very more prone to wearing things like PPE. So certain organizations are reporting lower injuries because, not that everyone's at home and not working, it's because people are just a little more aware of their surroundings. So it's funny how a pandemic brought that out, but I think that's a good thing. And as well as the invention of virtual health services. So I want to give a good shout out to everyone working in healthcare. I can't imagine how hard that would have been to all of a sudden take your whole career of working one-on-one with individuals to now having to do it virtually. That would have been such a challenge, and just a big thank you for adapting well to that. And again, it was showing our ability to adapt to the new work and to our new normal. So telehealth services are a great win because it helps us save some time on our already overburdened healthcare system in the province. So not every single healthcare appointment needed to be seen in person. I think of anyone who needs a prescription refilled through their doctor. They don't have to go see their doctor. Oftentimes it can be done over the phone. And I'm sure that's the case with a lot of appointments with physio, that not all the time you might need to go in. A simple phone call might suffice. So that's another good thing that invented through the pandemic is telehealth services. And I don't think it's going anywhere anytime soon. So that's basically the end of the session today. As promised, this is where all my contact information is. Feel free to reach out to me if you do have any questions that you didn't want to connect with me online. You prefer to do it offline, I'd be happy to do so. But now I'm just going to open up the floor and just touch base with our communications team to see if there are any questions and if I can help answer them. And if I can't, I promise that I'll get connected with you afterwards and we can see to get you an answer.
Thanks, Mason. Hi, everybody. My name is Nicole. I'm a communications advisor with WCB Nova Scotia. I just wanted to let everybody know we're leaving the questions open, so if you do have any as Mason goes through, please feel free to submit them. We do have a couple in the queue here, and we'll start with these. This one here coming off of what you just spoke about regarding COVID, Mason. So Tanya asked, did you find that many organizations were able to use COVID-related tasks like high-touch cleaning as transitional duties? Do you have any examples of that you can recall?
Absolutely, and that's a great question. Thank you so much for asking it. Great point. Yeah, there were some certain organizations, as I mentioned, where transitional duties weren't able to happen because of number restrictions. But on the flip side to that too, exactly your point. The pandemic actually created some transitional duties for things like you mentioned, cleaning, having extra bodies to make sure we're distributing PPE, all those types of things. So the simple answer to the question is yes. I did see some organizations that got creative with the pandemic and they were able to absolutely create some more job tasks for people to do, which is fantastic. So thank you again for asking that.
Great. We have another question here from Matt, who asks, how would you coach or educate an employer to develop transitional duties if they have nothing in place?
Great question. This is a lot of the work that I do right now. So I kind of already pointed out already that certain organizations find it challenging to create transitional duties. So what I would look to start with, if I sat down with an organization, I would just say, let's take a look at every single job task that you do here. And great organizations that have things like what are called job site analysis, what that is the breakdown of job tasks. And it does a great job of showing things like how much weight someone lifts, how long they have to stand, walk, what their tolerances are, like that. So where I would start with is I would look at, okay, let's take a look at every single job task you have here, and let's see if we can tease out if there's any way we can help create new ones. So that's a good starting place, is taking a look at what you do currently, and then see if you can incorporate, like I suggested, your health and safety committee to brainstorm some new ideas around, hey, yeah, I think that we can actually have another body to help do this, and something in that manner. So that's a great question, and it's very, very relevant.
Great, thanks, Nathan. We have a question from Jacqueline, who asks, can you help with a return to work checklist for mental health transitional duties?
Absolutely. So we have a lot of good resources here at the board around return to work checklists in general. And as we all know, and I think it's a great thing, mental health is now being talked about as it should be. So we are also looking at creating some new materials around supporting injured workers that might be dealing with psychological injuries. So that's something that I would suggest. Reach out to me after the session, Jacqueline, and I'd be happy to get some things developed and sent your way that I think that we could help support you in that way.
Great. One other question. So we have Tanya asks if you have a preferred clinic for direct access, but the worker wants to go to a different clinic closer to their home. Is that okay?
Yes, it absolutely is. So that's a great question. That's often what I talk a lot about with employers is they'll ask me, are we able to force people to go to certain clinics? And the answer is no. Workers can go to whatever clinic they would like to. When I spoke about the direct access, that's just, again, a good win-win for not only the healthcare provider, but for the organization. So the sell would be, from an employer's point of view, hey, the only reason we suggest this provider is because they know our organization, they know the work you do. So that's why we suggest it. But absolutely, workers are able to attend any physio clinic they want as long as it's WCB approved.
Thanks, Nathan. I'm wondering if you can provide an example of a success story of an employer that you've worked with, that maybe you've come in and they haven't had a return to work program in place, and you've kind of started from scratch, and just maybe talk a little bit about how long it took to develop that program and how it all unfolded.
Oh, thank you for that one. I have a great story that comes immediately to mind. And that's a great question, talking about how long this can take. And I understand that everyone's busy doing work all the time in your day-to-day life. So if you were to allocate, a couple of days at least to talk about where we want to start with the recruitment policy. So if you remember to that slide I pointed out where there's 5 key steps, at least getting something written down is the first step. And it's hard to really predict an exact timeline of how long it can take. But what I would suggest, and actually I will talk about one particular story, and that's they had nothing written down. So we started to learn a little bit about where they would like to go. I provided them those general templates as I spoke about. We had something written down. And then we were able to go from there and let's get you set up with a direct access provider. We did do that. And here's where my success story comes in, where this is to me showing that the return to work program worked very well. Is I can remember that there was an injury that occurred at 8:30. The people in the organization, again, this is all new, but they were educated on the process. So what they did was immediately sat with the injured worker, filled out a WCB injury report form online through my account. They submitted that to us. By 8:40 a.m., they had a physio appointment booked with their direct access provider, which would happen to be right next door. So they got in, treated. The worker was treated at 8:50 a.m. An hour or so later, the physio clinic called back and said, yep, this worker definitely has a muscle sprain or strain, but they have some level of function. So I see that you have provided me a list of other job tasks. How about we set them up with this or this or this? So that was up to the employer to decide, which they did. So about an hour and a half later, that worker was back to work on transitional duties, no time loss, no financial loss on their end. And that's great for the business too, because they didn't have to pay out temporary earnings replacement benefits. So that's one story that comes immediately to mind, where an employer started with nothing. It took a couple of days of understanding, and we got to a place where they have a great program right now.
That's great, Mason. Thank you. We have a question from Mark who asked what happens if the worker gets hurt again. And Mark, I'm not sure if you mean as they're doing transitional duties or after they've returned to work at their full duties. But Mason, you could probably speak to that.
Yep, absolutely. So if you are involved with a workplace injury and you're in the middle of a return to work process, and if an injury, if it's the same injury and it happens to get worse, that's just up to where we trust our medical professionals. They're the ones who are experts, again, in healthcare and in function. So if they were in the middle of doing something, let's pretend like a transitional duty, and they were re-injured, or maybe they feel like the injury got worse and it was the same injury their claim is related to, best practice would say, well, we need to get you treated. Let's send you back to your physiotherapist or your chiro, whoever you're seeing, and get reassessed. And let's see if we have to monitor or make adjustments to your return to work plan. So again, they might be doing transitional work, and if they got re-aggravated or that injury got worse, it could be found that they might have to stop work altogether or just adjust their duties. A great question. Thanks so much for asking that.
Thanks, Mason. So Rodney says, great talk, Mason, love the enthusiasm. Often our organization is proactive and offers duties based on their abilities, but are still stonewalled due to a doctor's note. What can be done here?
I'm sorry, Nicole, you broke up on that last little bit about the doctor's note. Could you just repeat that for me?
Yep, so Rodney asked if often our organization is proactive and offers duties based on their abilities, but are still stonewalled due to a doctor's note. What can be done here?
Okay, so when it comes to the role of doctors in the return to work process, absolutely yes. Injured workers should seek and let their family doctor know that, yeah, we had a workplace injury occur. But when it comes to return to work and function, we rely on physiotherapists to determine what the employee is capable of doing. So when there's a doctor note presented, if we have conflicting reports through a physiotherapist, it might be found that we're going to look to the physiotherapist's guidance on function. But then again, that's going to be a very big conversation between our case management team to connect with that doctor, their current treating physician, whether that's a physiotherapist or chiro. And that's where the collaboration and involvement in the employer is very important, because they'll have to understand of what next steps are to be done about this. So great question, though. That's a really good question.
Okay, Joshua asks, what should you do if you are a company with multiple locations in different cities throughout Nova Scotia? Should you have a WCB person at each location and develop a different return to work plan for each location?
Good question. I guess what I would be looking to see is what type of work are you doing? Is it all different work? Let's say from one organization that could be in Cape Breton and one could be in Halifax. My mind goes to right away is, are they doing similar work? And if they are, it could be beneficial just to have one person that's in contact with WCB in developing your return to work program or assign return to work responsibilities. I guess it's just what fits best for your organization as a whole already. So it could be found that it just works better for you guys to have one key contact that understands the work. But that's the key thing. If you do have one person, they have to make sure that they fully understand the job tasks in each location. So that's why I made reference to, I wonder if in your example, if they're doing similar work. If they aren't, and they're not really comfortable with what the other organization's doing, then I would recommend to look at that other organization to have their own return to work contact.
Thank you. Okay, so we had a couple of questions from employers whose workers have been experiencing either return to work challenges or delays, at least in part because they're finding their injured workers sometimes have multiple caseworkers or go through multiple caseworkers with the WCB. So just wondering if you could speak a little bit about, those types of delays that might occur on our end and anything we're doing to address that.
Absolutely, we totally appreciate that. It's best practice for people to have one consistent contact at the WCB. And I understand that we often or can shift around caseload. So I appreciate how that can be challenging for certain workers, but I want to highlight the fact that we do hear you loud and clear, and we are looking to hire more case managers to make sure that we are on top of these return to work claims and that we have consistent and good service for you, because you deserve it. And using things like my account, secure messaging is your #1 best way to communicate with us. So all of those things combined, I do again appreciate your comment on that.
Okay, we have one more question, and I think from there, as Mason said, if anybody has any outstanding comments or questions, please feel free to reach out to him directly, and he's happy to answer those and work with you on any specific questions you might have about your own workplace. So we'll take the last one here that says, how do you help coach coworkers to also understand that they should be supportive of their injured coworkers?
Oh, I love that question so much. That is so, so important. And that's where I really initially think of leadership. And in good leaders and good organizations, it starts from the top down. So if you are if you are a leader in your organization and you believe in return to work, I challenge you to make sure that you make sure everyone knows about that. So having education sessions about more about return to work, talking about the importance of mental health, making sure people feel connected and supported in the return to work process. And that's oftentimes can be due to uneducation. So a lot of people might say to themselves, well, why is so-and-so not doing all of their job duties? Like, that's not fair. That to me just says that they're not educated about that. So that's another reason why I said in all of my tips and tricks, find a good way to educate your staff about this. And don't just say that this is a program so we can get people back to work. That's not what this is. This is for all the good moral reasons to help support your injured workers and your fellow colleagues. So thanks so much for bringing that up. And yeah, that's a really, really important topic.
Thanks, Mason. So again, once again, we'll just ask folks if they have any outstanding questions to just reach out to you directly, and you're happy to help.
Perfect. Yeah, everyone feel free to reach out. If I can explain things a little more clearly, then absolutely connect with me. I'd love that further the conversation. I hope that the information today was valuable and that you were able to take some best practices around return to work. And I'm very excited to look to do this again in the future. So you'll see later this afternoon, we're going to send out a short survey, just talking a little bit more about the session today and trying to get your feedback. I'm open for feedback on ways I can get better, so please feel free to be honest. And just want to say a big thank you again for taking the time to join our session. And please, everyone, stay safe out there. So hope that everyone has a great day. Thank you very much.